earliest ways in which we realized life was not going to be the same for a while was heading to the doctors for a checkup or for any office visits, because you can't go to the doctor. So how do you see the doctor without actually going to the doctor? Telehealth is the answer, and it's something that the federal government is working to try to really speed the production of and the evolution of. So joining me now to tell us more about it, Dr. Stephen Levine from the Connecticut State Medical Society. Thank you so much, Doctor, for joining us today. And for people who aren't even familiar with the concept, how would you describe what telehealth is going to be and what it's going to look like going forward?
Hi, Tim. Good morning, and thank you for your good question. I do want to correct one thing. Telehealth means really the communication of healthcare or wellness overall. That's different than telemedicine. Telemedicine is a subset of that. Okay. And telemedicine is our ability to take care of patients who are having active problems and are feeling ill or feeling worried. And that's really what the focus of our concerns are right at this moment.
Yes, yes. It's a very good point you make. Thank you so much for the clarification. So just how broad of a net then are we casting with telehealth? I mean, what kinds of services are people going to be able to access remotely, and what kinds of services aren't they going to be able to access remotely?
So first of all, with respect to telemedicine, it's really about finding a way for us physicians to be able to communicate with our patients and provide them medical care in the safety and comfort of their home while they're practicing social distancing. We want to be able to do that without increasing the risk to our patients, to their families, and to their loved ones. And this is where telemedicine plays an important role.
Yeah. I'm so curious to see what you can do. You know, I mean, a lot of times you need to be there with a doctor. You need to feel around. You need to palpate. You need to be able to manipulate joints to figure out what's hurting, what's not. To what extent are some doctors, for telemedicine at least, going to be able to do that? How compromised is their ability to make diagnoses going to be?
You're absolutely right. For many of us, depending on our specialties, it really is a huge compromise not being able to do a physical examination, especially on someone we really don't have a familiar knowledge with. On the other hand, if it's one of our patients that we already have familiar knowledge with and we already have seen them in the past, telemedicine is an excellent way for us to continue to follow up and to provide additional care, make adjustments in their medications, and hopefully explain the situation for them and their families. So there is a role. It's not a complete role. It won't replace healthcare as we know it today, or the medicine, the touching, the laying on of the hands, as you say. But there is a great role for it, especially in this crisis.
Now, I would, and especially with this crisis, there's going to be a lot of people who need psychiatric or psychological services. I imagine this is tailor-made for that.
You know, it really is for all of us. I mean, we're all afraid. We're all scared of this virus. We're all scared of what this can do to us, to our families, to our loved ones. And we have to, we're a team. We are the human race as a team is on social distancing and home lockdown. And so this is a way for us to really extend ourselves and to be able to help one another together to beat this thing. And we will beat this thing. We will be on the other side of that curve in no time.
We will. I agree with you. And getting back to the correction you made earlier, just talking about how telemedicine is a subset of telehealth as a whole, you got me thinking, what other forms of telehealth are there going to be that I probably haven't thought of yet?
So perhaps there's a whole role for wellness to be able to reach out to people. That you can even telehealth can be as broad as even talking about exercising online. A lot of the health, the exercise gyms are providing online classes. My family all does, workout classes online together. That's another example of telehealth, as opposed to telemedicine, where somebody is truly sick and having a problem and needs an expert's care from a physician.
One last quick question. How would a typical appointment work in any of these sort of telehealth subsets?
In my practice, we will actually send a quick link on a cell phone so that the patient can have a click, and with one click, we'll get connected to our telehealth portal at a commonly accepted time. And then we do just like we're doing now, you and I talking over a web portal. We do the same thing with them with respect to their medical issues.
Okay, there you go. Dr. Levine, thank you so much for taking the time and really expanding our minds. You just got me thinking, we're actually going to have a telehealth appointment in my house for early intervention services for my child. I didn't stop to think that that was all part of the same umbrella, but it makes sense. So thank you so much for the time and for the knowledge.
Thank you for having me. These are extraordinary times, and telemedicine or telehealth are important new tools to get people the medical care they need without exposing them, their families, or their loved ones to unnecessary risk. Stay safe.